dear. Brilliant. And let me give you a hand. Hello, Miss Roxy. Come on through, darling. My name is Shannon. It's nice to meet you. Come on through. Okay, so I understand we've got Roxy in today, and she's in for her 6 monthly checkup. Is that right?
Yeah, she is. We're part of the VIP scheme. So
good, excellent. And have we had any worries about her over this last 6 months?
No, none at all. She's doing really well.
Fantastic, good. And she travelled down okay?
She was okay. She was just a little bit unhappy in the car, but she was okay.
She's quite vocal.
Yes, just a little bit.
Yeah. Do you try putting the radio on quietly for her, just to try to drown out the noise of the road?
I hadn't thought of that actually. Yeah, I could try that on the way home.
Yeah, that can help a little bit. And of course, you could put a little towel over her as well on the journey down sometimes. So, okay, well what we'll do is we'll go ahead and get her out so we can do her exam. Okay, Roxy, shall we get you out, sweetie? That's it. We'll just take that door off completely. Hello, darling. Are you going to come out on your own? She says, I'm not so sure. Tell you what, we can always take your lid off if you're not ready to come out on your own yet. It's a lot nicer than having to dump them out of the basket. There we go. Hello. I'll just put this over this way. Hello, Miss Roxy. That's a good girl. It's not so bad, is it? That's a pretty girl. Oh, her coat's in lovely condition. What we'll do is we'll start with you up on the scale. Boy, you do feel like you have a full tummy, darling. 5.18 kilos. I think that's up a little from last time. Okay. So we're going to have to think about that a little bit with regard to ensure that she doesn't get any pudgier. So what we'll do, if you can just stroke her head for me, I'll just see if we can just get her to relax a little bit so I can feel her tummy. That's it, Miss Roxy. Well done. Good girl. Clever girl. Well done, beauty. Good girl. That's a good girl. She's thinking, is this not what I want to do? That's a good girl. You're right. Well done, Roxy. Well done, sweetheart. Just go down your lymph nodes and just under the collar there. And if you just stretch under your chin a little bit, thyroid. Yeah, no problems there. Well done. I can feel a slight purr. Can't quite hear it, but she's doing all right. Yeah. I'm going to have a quick listen to her heart. That's it, Miss Roxy. Good girl. Just pop that up under your arm. She's definitely purring under that. Good girl. Good girl. Have you stand up for me, Miss Roxy? Good girl. Well done. That sounds absolutely fine. So if you just give her a little scratch under her chin, and I'm just going to come in here and see if I can take over and we can have a look at her teeth. That's a good Roxy. She has had some dental problems in the past, hasn't she? Yeah. Do you manage to clean her teeth?
We tried, but we're not overly successful.
Oh, bless. Yeah, it can be very difficult with cats. We do have a wonderful nursing team that is trying to give some really good tips with helping with maintaining the teeth. I know that a lot of people need a little extra support to help understand the easiest way to do that. So, maybe we can look to doing something along those lines.
That'd be great.
Okay, so I think she's looking generally quite well. We have a couple of issues that we're going to need to address. First of all, we do have a little bit more buildup of tartar on her teeth. Okay, I think the time is coming now that we need to get the teeth cleaned. Okay, hopefully if we do it at this stage, it'll just be a scan and polish as opposed to needing to have any teeth removed, which of course is what comes next, you know, if it's not done in a timely order. Now, she's already over 10, isn't she?
She is, yeah.
So I think it would be advised for us to do a blood test on her in advance of dental work, not least of all because the dental work does require an anesthetic.
So what will the bloods have?
With her, I would recommend that we do what we call our geriatric screen. And I'm looking at the basic things that I feel would be relevant to a cat of her age to check her general health. We're going to be looking at her thyroid levels, okay? We're going to look at her kidneys, we're going to look at her liver values, her blood sugar levels, her proteins, and checking for anemia. These are all really relevant with a cat of her age and a cat that will be going under an anesthetic. And there are also things beyond the scope of what I can do with an exam, a physical exam. So it's looking at the things on the inside. So, so would you be happy for us to do the blood work today?
Yeah, that's fine.
Okay. That's all right. Well, what I think I'll do is I'll go ahead and get her into our basket so we can take her around to the back and the nurses can do the blood. So I'll just grab that here. All right, Miss Roxy, mind your tail, pumpkin. There we are. All right. That's a good girl. All right, Roxy. Shall we get you in this basket? That's a clever girl. Well done.
It looks like such an easy basket. I really struggle getting her into ours at home.
Do you? Yeah, I hear that quite a bit. I find that these top-loading baskets are much easier, especially for those cats that are quite nervous or those that are very difficult to get in or out, because you can just kind of put them down in there. The one thing I usually do when I have a client that has one of these, I recommend that when they're traveling you put a towel over it so that they feel a little more secure and protected. So, but it's only a short trip back to the back with her, so we won't need to do that for this short trip. And she's settled down already, hasn't she? Bless her. Well, look, it'll probably take about 10 minutes for the blood work, but I will be back with you as soon as possible.
That's great.
Okay, no problem. See, here's Mum. Just get that door behind us. And we'll get you up here. She was an absolute star.
Was she?
She was, yes. What we've done is we've had to shave a little spot on her neck for the blood. That fur will grow back with no problem, and she's so fluffy, it'll just grow. You won't even see it. So, so the plan is that we'll give you a ring back with those blood results. It may be at the end of the day today, or certainly tomorrow we'll be in touch with you. And we'll go forward from that. Assuming those results are fine, then we can go ahead and book the dental work, okay? But we'll need to see what those are first. And the only other thing really is with regard to her weights, that we can try to help you a bit more with getting her to slim down a little more. I'd like to speak to one of my nurses and we'll get you into one of the slimming clinics that we have for these guys, which will help give you a lot of support and guidance on the best way to get that weight down. Okay, thank you. So, all right, Miss Roxy, what we'll do is we'll just move you into your box, all right? That's a good girl. You've been such a star. There we are, my darling. Good girl. Right, if you just give her a little tickle, I'll get this over and we'll swap her into her basket. So good. There we are. Get you back in here. You're going to go in nicely. There we are. She says yes. I'm very happy to go running in now. She easy to get in at home.
Well, no, it's
really.
quite difficult normally.
Oh, bless. Sometimes with these ones where you can't take the lid off, one of the easier ways is to turn them around backwards and have them go in backwards.
Oh, right, okay.
So I find that can really help because you can kind of tuck the feet in and then just push them in that way.
Oh,
so
that's a really good idea.
and it's a little bit less of a struggle that way. So right, so that's pretty much it for now. Have you got enough worming and flea product for the moment?
Yeah, I think I've got another 3 months worth, so I'm fine, thank you.
Brilliant. Well, let me know if you do need some more because we can always get some more for you in the interim. And then, have you got any other questions we haven't talked about today?
No, I was just wondering, I noticed when I came in that you've got a cat-friendly area. I just wondered how it's cat-friendly.
Yeah.
What does that involve?
Absolutely. Well, basically what we wanted to do is create a place that we can have our cats be separated from the dogs, because obviously most cats that come in are not too happy to have a Labrador's nose in their basket. Yeah, so what we've got is an area, as you could see, there's the kind of the little cine wall, and then they can be put in the cubby hole there, which is a bit darker and more secure, and in most cases that's going to really help reduce the stress before they come in. And the other things that we would do is that we have a towel on the table when they come in. I find cats are much happier having a nice soft surface when they come in under their paws and something fairly clinical underneath. In the back we've got a fantastic devoted cat ward, so that we don't have the smells or the sounds from the dogs in that area to help minimize the stress. And then there are a few other kind of more subtle things that we can do. For example, Feel Away is a cat pheromone. And so the idea is that it helps to soothe them. We can't smell it ourselves. It's plugged in now. I'm sure you can't smell anything. So we have that in all of our rooms, and then we would also, for somebody if they had a very stressy situation at home, they can use this either for short or long term as well. So it's very handy, and it can be very effective for many individuals. Roxy. All right, Linda, we've got Roxy and Mrs. Bentley. Okay, so all the bills complete. There's no medicine to come through.
Lovely, thank you.
Hello, Roxy.
Everything okay?
Okay, I've got the estimate here for Roxy's dental. Okay, and so once we've got the blood work back, we'll be able to confirm that we're going to go ahead and go forward with this, and we'll get in touch with you with those details.
That's right.
Just thinking, on the day that she's coming in for the dental, if you could pre-think that perhaps about a week before, bring her carrier down from the loft or wherever it normally is staying, and then she can go into that and kind of familiarize herself with it. She may even choose to sleep in it at home. It might make her a little bit more comfortable when she is going to need to go in it for real, coming down to visit us.
Okay, I'll try that.
Okay,
Brilliant, thank you very much.
Well, good luck, and I'll be in touch with you in the next 24 hours or so.
Great.
All righty, take care. Bye-bye.
Bye.